Calgary Southeast.
Mr. Speaker, I've said many times in this House that we need to address the rising healthcare costs if we're ever going to get the budget to balance. When I raise these concerns in the House, the government is quick to point the finger and accuse us of wanting to cut funding for frontline services. It appears as if the government is trying to divert attention away from the fact that their own fiscal plan is beginning to have a direct impact on frontline services. The most recent budget saw this government cut funding to Alberta pharmacists by $150 million. Would the minister agree that this is a direct cut to the frontline services, or does she not consider the work of pharmacists a crucial frontline service?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. I find it very rich to the member opposite when they have their own shadow budget, proposing $1 billion worth of cuts, proposing increases fees of user costs. Sounds like the rejected healthcare levy that was proposed by his leader when he was the health minister in the last election. And at the same time, Mr. Speaker, what we're doing is we are increasing pharmacy by a reasonable rate of increase, which is 4.3%, to cover the fact that there is inflation, to cover the fact that there are new people going on new medications. We've got balance on this side. On that side, all they've got is old recycled ideas of deep cuts from the 1990s.
First supplemental.
One thing we often suggest to the government is that instead of cutting funding for frontline, as the minister has done, savings can be found through efficiencies. The government likes to laugh at that, but the issue is that the pharmacists provide a good example of what we're referring to. One service that the government is cutting funding for is paying pharmacists to provide flu shots. Lowering the incentive for pharmacists to provide flu shots means that more shots will be given by doctors, and a flu shot given by a doctor is about 4 times more expensive. To the same minister, how does paying doctors more money to deliver the same number of flu shots save the province money at all?
Great question. The Honourable Minister of Health.
Well, my question to the member opposite, and rather his leader, Mr. Mandel, who was the health minister, is how does it make sense that we pay 50% higher than the next highest jurisdiction, Mr. Speaker? I don't think that's fair. We sat down with pharmacists and we said we want a fair plan that ensures that patients still have good access, and we're still going to be paying the highest in the country. We're just going to be tied instead of being 50% higher than the next highest in the country, Mr. Speaker. I think that's fair and reasonable. And I have to say that cutting $1 billion from the frontline workers of healthcare, or at a time when fentanyl was on the rise, your leader turning down $1.4 million of funding, no strings attached from the federal government to address fentanyl crisis, that is irresponsible, Mr. Speaker.
Mr. Speaker, pharmacists are well-trained, highly educated medical professionals, and we rely on pharmacists to know all the effects of medications, to warn of potential dangers of mixing drugs. They provide advice and consultations for people struggling with mental health, addictions to treatment, chronic conditions, and are often the medical professional that people see the most often. Pharmacists are saying that the government's proposed cuts would put patients at risk by limiting their access to these types of services. To the same minister, why are you choosing to cut fundings in these areas that will directly impact Albertans' health and well-being?
The Honourable Minister.
Well, once again, Mr. Speaker, the member opposite is dreaming in Technicolor. We have a 4.3% increase to that line item. It's important to us that that go towards patients and ensuring they can continue to access important services, Mr. Speaker. We're proud that we've worked to reach an agreement, a collaborative agreement at 4.3%, under the watch of that member's leader, now leader, then former health minister. We saw 12% increases to that finance line item, Mr. Speaker. That's irresponsible. That's not in the best interest of Albertans. Conservatives let things balloon and then they push deep, drastic cuts, saying they had to. On this side of the House, we work with people to develop sustainable, reliable, frontline care.